inaugural speech on November 27, 2018, Governor Adegboyega Oyetola promised to ensure that people of the state live healthy lives. He promised to ensure that both primary and tertiary healthcare services are at their disposal at no or little cost. At the twilight of his administration, precisely on November 20, 2018, former Governor Rauf Aregbesola signed into law the bill to establish Osun Health Insurance Scheme. Shortly after Oyetola was sworn in, he immediately swung into by ensuring implementation of the act. Speaking with Osun Focus Crew, the chairman of the Osun State Health Insurance Agency, Honorable Adeoye Adelakun, explains how Oyetola kick-started the scheme.
The establishment took a while because ordinarily there will be some activities before its establishment, such that it takes off as soon as the laws got signed to law. The bill that established the scheme was signed to law on the 20th of November 2018 by the former governor of the state. The bill was signed to law barely 7 days to his handing over to the present administration. And before then, they had made a search for people that could operate the scheme. Because the scheme came to life basically because of the universal health coverage, which is being propounded by the federal government through the Federal Ministry of Health. And the thing became operational the moment the bill was signed to law. But this administration, the present administration, started on the 27th of November 2018. But the bill only came into existence, became law on the 28th of November, just 7 days before the governor left. Well, the issue was not without its initial problems, because the new government, because of its passion for the takeoff of the scheme and its passion for the health of the people of the state, decided to actually allow the scheme to take off immediately. And he first of all gave the scheme a sum of 150 million naira as take-off grants.
The operation of the agency has been so pleasing to all its enrollees. The chairman explained the categories of 208,660 subscribers to the scheme.
So as much as possible, the passion of the governor contributed a lot to the success attained by the scheme so far. Like I said, the civil servants who are the sustaining factor of the scheme, first of all, did not want to really be part and parcel of the scheme. Because the moment it was said it's going to be contributory, that is, there's an amount that will be deducted from the staff salaries, while the government will now add the other. They became very skeptical because of the experience with the contributory pension, which is having some hiccup with the state government. But along the line, the civil servant and the leaders of the workers got convinced about the possibility of this scheme yielding a very good dividend. So they started to agree to actually be part and parcel of it. So to a greater extent, I can boldly say that of the total number of enrollees that we have 90,169 members of staff of this state on the scheme, and they are already accessing care. And the scheme, like I told you, consists of 4 parts. We have those in the formal sector. The formal sector are the employees of government who get paid directly by government. The informal sector are the people who are artisans and they are self-employed and they are not working under government. And the third category are the teaching, students of tertiary institution, where we take care of the health of those students. Their parents are not around, but they are there. Their health must be taken into consideration. Under the informal sector, we have 2,484 that are enjoying the scheme as we have now. While the T-ship, we have 43,915. The people in the formal sector, the government merely deducts 1.5% of their basic salary. 1.5% of their basic salary, and the government adds 3% to it, which they pay over to the agency, and that is what we use in taking care of their health. While the ones in the informal sector, we need to pay 12,066 annually to get coverage under the scheme. But if you want to bring in your family into the scheme, you have to pay 57,600. And the family package consists of the husband, the wife, and 4 of their biological children, which is, you have 6 lives covered under the scheme. But the children must not be more than 18 years old. 4 of them. And be that as it may, we have under the scheme, under the informal sector, 2,484 people enjoying the scheme in the state as it were. But the T-ship, the students of tertiary institution, in all the tertiary institutions of the state, we have 43,915 enjoying it. And the last one is the priority population. The priority population are the one we refer to as the vulnerables, the poorest of the poor, that they cannot even afford any Medicare by themselves. So they take care of all their Medicare at the primary and secondary level, and they don't have to pay anything to the scheme. Right now, we attend to them under 2 schemes, because the federal government pays to the insurance the basic healthcare provision fund, while the state government also pays us their own equity grants. We take care of these people with these grants. And so far, as we have now, under the BHCPF, we have 40,172 people enrolled under the scheme. While under the state equity fund, we have 31,399. So for the vulnerables in the state, we have 71,571 people under that scheme. So to a greater extent, everything put together, we have 208,760 people enjoying health insurance in the state as we speak, as at 1st of June 2022.
On the sustainability plan, Honorable Adelakun gave kudos to the governor for prioritizing the project. He said since Oyetola's administration has not defaulted the payment of workers' salaries, their premium and subventions have also not been defaulted. The chairman speaks further.
Sustainability we even here in the agency, we do at any point in time 2-year sustainability plan. At least whatever we have now, as we speak, we are sure that this agency can sustain its activity for the next 2 years. And we are expecting more funds into it. And for as long as we have this governor on seat, I'm sure this agency will not suffer anything. Because the moment the government is not actually failing in payment of salaries, definitely deductions from staff salaries will come here. And we maintain a lot of these patients through these checkups that comes from government to the agency in respect of the workers. Definitely, if you are able to sustain it through the workers, we'll be able to sustain the informal sector that are paying their 12,000 and 66 and 57,000 as the case may be for their families. And definitely, the vulnerable population will also be sustained because annually the federal government sends to us basic healthcare provision funds, which we use in maintaining these people. And we shall always get equity grants from the state government.
It's recalled that the government recently announced enrollment of 30,000 youth into the scheme as part of its effort to further engage and empower Osun youth. The OHIA Chairman explained how the funding has been catered for.
It will be taken care under the vulnerable, the priority population. The youths are not supposed to pay a dime, but we will take them up their treatment up under the vulnerable scheme. And because they are, if they are not under their parents and they are really there out there, they need health care. And that's the more reason why the state government is interested in their cause.
In a bid to ensure that the hospitals providing services to subscribers meet the targets of providing standard services, the Osun Health Insurance Agency has in the recent past spent millions of naira on provision of equipment for hospitals.
We are also involved in the quality improvement of our hospitals, particularly the government hospitals, because they need to really improve their standard to be able to take care of the people. Recently, we have been able to actually intervene in the improvement of some of the hospitals. For example, Ashibiaro hospital here, we have actually been able to inject a sum of almost 29 million naira to acquire a generator for them. Well, at the point in time, their generator went bad and they couldn't afford to really get one. The health insurance gave them money to acquire a good one, and at the end of the day, all this money will be recouped from the capitation. You know how the health insurance works is this: every lives enrolled in any of the facilities, we pay them money at the beginning of every month to cover all lives coming to them. And that is why they will not, when you go there, they will not ask you for money. What they will not ask you is that when they treat you, the drug elements that they are giving to you, you only pay 10%. Which means that if you have your drug element is about 100 naira, you are going to pay just 10 naira. That is 10% of your drug element. That is what you do. So, but in the case of the vulnerables that I mentioned, they don't have to pay anything. They won't pay premium and they don't have to pay anything as co-payment for whatever treatment they get.
The OHIS covers all ailments except cancer and psychiatric ailments.
In this period that we have been on board, we have done 332 surgical operations for our enrollees. So I will advise people in the states to take a cue and be with Osun Health Insurance Scheme such that their health can be guaranteed at very, very small money.
In the last few weeks, the agency has continued its drive to have more people on the scheme. The last one was done in Iwo local government area of the state. One of the beneficiaries spoke with Osun in Focus Group. Mr. Ajani Koko also advised the people of the state.
bákan náà àwọn tí wọ́n jẹ́ àwọn olùtọ́jú àwọn aláìsàn náà wọ́n tó bá ní ké gbàjarè fáwọn ìjọba wa láti fi ẹ̀bù wa láti gbógun ti àìsàn.
Honorable Adelakun speaks on why Osun residents should re-elect Governor Adegboyega Oyetola.
We gain a lot by re-electing Oyetola. Number one, Osun right now is in a dire state. Dire state in the sense that we cannot afford a profligate to take over the reins of power in Osun. Because before we know it, there will be no money in there and the place will run dry. We need somebody with full managerial capabilities and who is very deep in financial engineering to manage the state. What we have been able to get in the last 3 years plus in this state, that we have not actually run into any serious problem financially, is because the man has not even come into government to grab. He has come into the government to contribute his personal integrity and to ensure that things go in a manner that people will not run into serious difficulty. I am of the opinion, and I beat my chest at any point in time, that an Oyetola in government in Osun is a security for the able to have a good life and good governance.